Assalamu alaikum and welcome to In Conversation with me, Femida Cassim. The United Nations and WHO have urged governments to put women and girls at the center of their efforts. Joining us via Zoom from the United States of America is Dr. Padmini Murthy, a physician and an activist. Dr. Murthy has also been at the forefront of organizing workshops and seminars internationally on women's health and is joining us today to share the challenges being faced with globally. Welcome, Dr. Murthy, and thank you for joining us.
Thank you so much, Femida. Ramadan Kareem to you and your team and all your viewers. Thank you so much. It's a great privilege for me to be on your show. And I can't believe it's been a year since we physically met at that excellent conference we were at in Riyadh, Saudi Arabia. Thank you so much.
Thank you, Dr. Murthy. Yes, I remember it was quite a while ago, just when COVID was at our doorsteps. Dr. Murthy, before we unpack the global issues affecting women, please share with our viewers more about yourself.
Thank you so much. So I'm a physician. I was born in India. I live in New York with my family. I'm an Indian American, and I'm the proud mother of a daughter. And, one of the things growing up for me, I mean, my parents, they always taught us to respect everybody and, not have prejudice. And one of the things I have found, not only as a physician, but then I went on to do my public health, working since young, is the power of conversation, the power of media can make so much of a difference. And really, I am so thankful to journalists like you and so many other people who just get the message across relentlessly. What is important is the same as being a physician. You don't put yourself first. You put somebody else first. I mean, I might put my patient first, my colleagues and I, but you people put yourselves first in getting the message across. And as you mentioned, I am very passionate about women's health and also the whole well-being, the whole holistic picture. I'm a writer. I have published 4 books, and I also write poetry. And the other thing I think, which is so important as an NGO leader, we need to do whatever we can as women. It doesn't matter that you're from South Africa. I'm Indian American from New York. We have certain common issues, Femida, which affect all of us. And thank you so much for this conversation, because I hope we can talk about some of the challenges we are facing and what is being done and what can we do globally. So it's really nice to have this one-on-one with you, as you have with other guests. I follow your work. It would be so nice if we could see this TV show here in the US. I look forward to getting the link from you and sharing it, because it's very important to showcase what is being done in another part of the world, but which does have a global impact. Thank you. Over to you.
Thank you, Dr. Murthy. Thank you for also acknowledging the work that we do. And as an NGO leader, you were mentioning that you're also at the forefront of women's health issues. So what sort of trends have you seen occurring against women and children during the pandemic?
Thank you. Unfortunately, violence against women, gender-based violence, has reached new proportions, Femida, during the COVID. And I'll tell you why. Because a lot of times the shelters or the services women can access have been shut down. So this has posed a greater challenge. It's not only in one particular country, but it's in a lot of areas. And some of my colleagues, physician colleagues, younger women with the younger children, my daughter is grown up. She's in university doing her PhD. But the reason I bring this up is because they have had to choose between doing what they love, their careers, taking care of the family. Because now, if you have a younger child, it is remote learning for a lot. And so it's very hard trying to do this. And they've been burnt out because also there is no support at home often. It's like the woman is doing that. It's not that I'm trying to blame men, but the sad reality is the burden, even though you're a professional woman, of taking care of your children, taking care of the house, and now with the added on task of attending to the children's well being, education, and at the same time doing your professional duty has definitely caused a lot of, we call this burnout, Femida. Like you can't cope with it, and it has caused a lot of physical and mental stress. And one of the things is, it's so sad that a colleague who was an emergency room physician, she was so depressed, initially when COVID started here in New York. She unfortunately committed suicide because, as a physician, she was so helpless that she could not do anything to help her patients. And it took a toll on her, and she was depressed. So, what I'm trying to say is, first and foremost, whether one is a physician, a woman, a journalist, or a teacher, we are all professionals. And we have the same, feelings as others. We have the same needs and we need support. So this is one of the challenges. So that's why what we have been doing from my NGO, American Medical Women's Association, is we have a support group in the sense that you have a Facebook, you have frequent calls where people can reach out if they have any issues. So this is some way in which you try to help others. And there are so many lines here in the US where you can call for help. But that being said, fast forward, that luxury is not enjoyed globally. Because what happens if a woman loses her job, her spouse loses his job, she becomes, the washing board, or she bears the brunt. So this is something which we really need to be thinking about. And I think you're having radio shows, TV shows, or podcasts like this really help women understand they are not alone. See, Femida, I can feel your passion in what you're doing. You can relate with me when I'm speaking to you. We are thousands of miles apart. We are in different continents, but we are connected through technology. So I think technology, more than ever, is playing a role in connecting us. So this is how women are connecting with each other. And also, in some of the Latin American countries, what they have done is they on the apartment buildings, they have hung banners made by women with telephone numbers where you can contact others in case you're having trouble. A number you can text, a number you can call. This is so important. And UN Women, working with other partners, has got a Spotlight on Violence initiative, which they've committed millions of euros to. And what they have done is they're leveraging the private sector, the NGOs, and the academia. And even when I talk to my students, as you said, I'm a professor. When I talk to my medical students or other graduate students of public health, I tell them, if you feel lonely, talk to somebody. It's more important than ever to talk, just even the 5 minutes. So one of the things I think what we can do, Femida, is give somebody the time of 5 minutes once in a way to reach out. Are you okay? Do you need something? Because we are social people. And the pandemic, unfortunately, has made us socially distant. But that doesn't mean we need to be distant from each other while communicating. So this is important. And again, I think one of the challenges, as I said, is, violence against women. And there are other issues which we will discuss as we go on. Thank you so much.
Dr. Murthy, you picked up on such important points that a lot of women are experiencing. I mean, myself also as a female, a mom, we have this concern of that the kids have to do online. At the same time, we have to be at work. So how do we juggle all of this? It's quite difficult. And also keeping in touch with each other, keeping in touch with women out there. I think it's so important for women just to also pick up the phone and just see how the friend is, how the neighbor is. Just speak to each other. It's so important that you mentioned this. Dr. Murthy, you also mentioned about women being burnt out, while this pandemic is ongoing. What sort of tips can you help to give women out there that are experiencing these?
Thank you so much. I think, as I said, this resonates with all of us, Femida. Burnout, what I suggest is just allocate some time for yourself. We need to do it, because if you are not strong, if you don't take care of yourself, nobody else is going to be there, because women are the crux of their societies, of their houses. And if they break down, the ripple effect is going to be greater. I myself do yoga, Femida. Remember when you spoke to me a few days ago, I said, I go like, it's early in the morning. You go, you're up early. I'm so sorry. I said, no problem. I'm doing my yoga. I find it doing exercise and breathing, it really helps you. Not only does it help you physically or mentally, and again, I know the gyms are closed with people losing jobs. It's it's another added expense. But walk around. If you can't walk outside your house, you can walk inside your house or do some gentle stretches. This is something we have to do. And if you have access to the internet, and there are so many free classes where people get together, connect via Zoom as we are, to exercise together. So that's a way of getting closer together, because you are exercising with somebody else. And, you can even talk to them, you can connect with them. So one of the most important things, I think, is exercise, keeping a positive attitude, and you need to spend that 10 minutes for yourself, just not doing anything but, connecting with yourself, walking out. And especially for those of you who are celebrating, Ramadan, this holy month, it's so nice, because it's also a time for introspection. It's like, yes, what can I do? How can I make myself stronger? Because I am there for the people who matter to me, and also my other sisters, that is other women. So I think the self-care is very important. And we can do exercise which does not involve us any expense, which does not make us spend money, because that's another thing. Everybody around has taken a financial hit due to COVID. So this is something we can, do. Spend some time with your children, but again, you need a break from everyone. Just take time, at least 10 minutes a day. That's what I do. I don't answer my phone. I do not look at my emails, because we are constantly doing that. I just sit down and I just stare into space, or just go out for a walk. And that really helps, because Femida, as you know, the research shows that when we do exercise, we have endorphins, and these help us to keep our mood happy. So this is a way which I have found, which has really helped me going through COVID, is my walking and my doing yoga and breathing exercises. I hope I've answered your question.
Oh, you have. Thank you so much. Dr. Murthy, we're going to just be back after a short break. Welcome back. Just before the ad break, we heard from Dr. Murthy from the United States of America how women can't cope during the pandemic, especially women have been burned out and are finding it difficult to basically breathe and continue with a daily task. So basically, Dr. Murthy was saying we need to exercise, we need to have a positive attitude. Dr. Murthy, what else can we do?
Well, thank you so much. I was hoping you would ask me that, is be well hydrated. During the break, I just drank water. Try to eat healthy. The other thing is, Femida, we are all human. If we can't cope, we need to say, please, I cannot cope. Reach out for help. Reach out for help. That's very important. We need to have these channels which are open for women to reach out to help. So I think we have to do that. And if there's nothing, form a circle of 6, as I call it, among your close friends. Check in with each other at least twice or thrice a week. It just can be a simple message on WhatsApp or whatever platform you use, like, are you okay? And then with a thumbs up or a smiley face. The reason is we're all busy. But this thing of connectivity, we know that there's somebody else also who's thinking about us. So please, we are all not super women. We do a lot, yes, but we need to reach out. And it's nobody should be judgmental to us when we say, you know what, I need a break. I can't do it. So all these are really important.
And doctor, apart from the women who have like spoken up and found help that you've basically been meeting, obviously, South Africa, we don't have access to what you have. What can you say to those who have not reached out? What coping mechanisms, apart from the daily routines, the exercise, what coping mechanisms should they be looking out for? Should they be saying positive words to themselves?
Yeah, I think it's very important. And as you say, when I mean, remember I mentioned introspection. It's just that you sit down and then you start wondering, and then you think that, okay, what do I need to do to make myself cope better? And let me tell you, this may seem strange, but this comes when you sit down and then just like try to declutter and think, you will get the answer. Because the way, the power human beings have is resilience, Femida, and coping. So it comes from within ourselves. But I think also when you have I'm sure even in South Africa, you have groups where, now like you might have a Zoom prayer meeting or some meeting, or even if you're not connecting by Zoom, if there is some way, depending on even the radio, it's so powerful. I think still many houses have radios. At least I know I still have a radio, and sometimes I listen to it. The reason I bring this up is we need to start seeing what is the best thing we have. And if there are no mechanisms, I would say that, you know what, go ahead, try to create one with the local resources we have. I cannot, unfortunately, go into a lot of detail as to what you have and you don't have in South Africa. But one thing we all women have, we are strong, we have resilience, Femida, and I am sure at some point when we interact with each other, we can come up with something which really helps us feel good and feel loved. Because one of the things I find myself as a woman and other women I talk to is you feel like, oh my God, I have the weight of the world on my shoulders. But you know what? You need to like say, that I can put down the weight for a minute and I need to focus on myself. So that's why I think introspection is so important. It is easier said than done. Believe me, there have been times and days when I'm like, oh my God, what's going on? And we get agitated. But at the end of the day, we just need to take a step back and focus. See, it's easier said than done. And your TV station, what you're doing is you're reaching out to women. When you just said, as a mother, even I feel burnt out. I said, I have felt burnt out. So when people watching this, they say, oh, they're just like us. So it's not that you are a diva because you are, doing this great work. But again, you are normal, just like the woman who's tuning on. And she could even tell her family, see, Femida out there, who is this journalist who's doing so much of work, has the same feelings as me. So I am not inadequate. So I think what you're doing is so powerful because you're making women understand wherever they are, the feelings are same and they are valued. See, you are valued. You have a fan following. People like you. People look up to you. My students or other colleagues, okay, when I say something, they say, okay, she's making sense. But when I say, guys, I can't do it anymore, I just need a break, they say, oh, That's nice. She feels the same. She's not superwoman. I think she is. So I think this is very important for Mida. Like, having things like this reach out. It can be in so many ways, or even just talking to people. Before we would all go shopping, but now it's limited and everything. But I think even with all the meager resources we have, and I was seeing a picture the other day, which was so interesting, that some of women who were getting water at a rural village in India, they were standing 6 feet apart. There were no circles, no lines, but then they were smiling and waving to each other. So it's your acknowledging. You see a human presence. See, that's important.
Yeah, it is important that people must understand that as much as I'm doing TV or you're a physician, we all are going through similar situations as women, and we need to assist each other out there. So inshallah, I'm hoping that at the end of the show, I'm going to put my phone number on the screen, and hopefully if there are women out there that are actually experiencing some sort of burnout, I'd like to urge them to actually, just send me a message. And with Dr. Murthy on my side, maybe I could just pass it on and Dr. Murthy can advise how we could assist them further. Unfortunately, I don't have an organization that I can refer them to. But Dr. Murthy, I want to actually go on to gender-based violence. Like when we compare pre-pandemic and now, how much of an increase has there been with regards to gender-based violence?
Thank you, Femida. One of the challenges, there has been a considerable, increase. If you look at what the reports coming out of the World Health Organization or UN Women, the UN agency, which looks into women's issues, and the recently concluded Commission on the Status of Women in New York, which was virtual, is, and Femida, I am so happy to send you the link so that you can share it with your viewers, and hopefully next year, because anybody can access those events, so you could access them. So coming back to that is, I think the number of it has gone anywhere according to unofficial reports. The reason I say unofficial, Femida, is because not everybody who is the victim of violence comes forward and talks about it. So it has increased anywhere between 15 to 20%. When talking to my colleagues in different sectors, this is why I'm saying it's an unofficial report. It can be a lot more. And one of the biggest challenges, let me tell you, have we ever thought about it? And there's a friend of mine who is pushing for this. She's also a physician. When you wear a mask, right? When you wear gloves, it is not specifically made to women. So you see, this is another challenge. The PPE there is just made. So a woman may be smaller. So what about the correct fitting of the mask or the gloves, like when you're seeing patients? So I'm just trying to tell you. So this is another challenge we are facing, even pre-pandemic. When you look at women who are working as tea pickers or in factories, the protective gear is often not made keeping women in mind, Femida. It doesn't matter which country you're in. So this is something we need to have gender a specific protective gear that is very, very hard to find. So I'm just telling you. And the other challenge when you're talking about gender-based violence, it's also, women with curfew, they cannot go out. And if I may introduce, one of the challenges which we have found is girls and women do not have access to feminine products, Femida, especially during the pandemic, because you cannot go out to buy it because of curfew. If you have lost your job or your partner, spouse, or, there is an economic downturn in your house, women's needs are put at the bottom. So actually, working with a young woman from Pakistan whom I met, I'll try to connect with her again. She has this app which she came up in Pakistan. This woman has special needs. She's in a wheelchair, right? She cannot walk. So she came up with this app to see where women can download the app on their phones and send a message that they need these products. And she's been working with the private sector. She just started it to see how can this be, given. And one of the other things I have been doing from my NGO, we've been working with students, medical students, not only from my medical school, but so many, to come up with sewing reusable pads for girls, so that they can use it. And we are working with one of the first ladies of one of the countries in doing this. So I think this is so important, because when we're talking about violence, it's just not slapping or telling somebody, but it is also the lack of access, Femida, and the lack of access to what women need. This is not a luxury product. This is a natural phenomenon which occurs in a certain age group, and women need the assistance for that. So these are some of the challenges which have become even more highlighted during the pandemic, So,
Dr. Murthy, are these products being given for free out there?
Yeah, that's what we're working on, the initiative. And down the road, if this becomes successful, I will, let you know about it. So one of the things we realize is what we are collecting funds, and then students, they can give up their coffee for a day and get the money. This is what I had my students do by working with the former First Lady of Malawi. They gave up their coffee for a day, collected money, raised funds, and then we were able to send thousands of dollars to build a maternity waiting home for women, because you know what, they have to work long distances. So coming back to your question about the pads, it's just not supplying the pads initially, but also we want to teach the women in this country. We are going to be working now. Once it's fully underway, I'm very happy to share the details with you to see how can women and girls sew these pads using the cloth they have. So you see, whenever we are doing some work like this, it's also the sustainability, Femida. It's just not giving something. Like, you are telling people where the resources are. So you're making them aware, you're teaching them to get help. Similarly, by giving them these reusable pads, which are being made by our young students, they have two ways. They either get money to buy these reusable pads being made by another NGO, or sew them. We have sewing teams, but also what's going to happen down the road is we are going to teach the women in this country how to sew these.
Excellent work. We're going to be back after this short break. Welcome back. Just before the ad break, we heard from Dr. Murthy how women's health issues have increased since the start of the pandemic, and how tight budgets, loss of jobs have been affecting many households, and how to cope with being burnt out. Dr. Murthy, you were talking earlier on about some sort of partnerships. What's the way forward on partnerships?
Okay, thank you so much for this question. And again, let me tell you, I've done quite a few shows, but I'm really enjoying being on your show. It's so nice, because I think what you're doing is so, you're really focusing on the main issues, and you're getting me to talk about issues which are common to all of us. So coming to partnerships, just let me tell you quickly, with the COVID pandemic, there was a severe shortage of masks. Your viewers need to understand that even in countries like the United States, there is a shortage. And we have a group of our Native Americans, and the areas they stay is called, the Navajo Nation. That is the term given to them. I think you are aware of that. So what happened early on was they had a severe shortage of PPE. And a lot of the Navajo Nation residents live in remote areas, So what we did is, from my NGO, American Medical Women's Association, working with another faith-based NGO, which was a Buddhist NGO, and then we mobilized students, and we worked with the Attorney General's office in Arizona. And we worked with one of the local airlines there, the private sector, and the pilots. End result, Femida, in about 2.5 weeks, this was called Operation Pegasus, we were able to donate over 80,000, yes, 80,000 masks to the Navajo Nation. So this was coordinated through the Attorney General's office, and the pilots gave their spare time, and the airlines, they gave their aircraft. So these were dropped. They were airdropped in the Navajo Nation. So this is a partnership. So it's like, it was medical women, it was students, right? It was government, the Attorney General's office. It was another faith-based NGO. It was the private sector who donated this. The private sector, that is the airline industry, who gave us a plane loaded the cargo to drop this, and also the pilots who gave their time. Similarly, Operation Pegasus also, we had our young students, printing out these face shields with 3D printers using plastic. So that is another project we did too. So this is the power of partnerships. Now, coming back to something like this, in India during COVID, Mother Teresa's foundation, they did not have food. Like, the sisters reached out to us. So what we did is, we all got together. So this was, again, through various countries, and working with people there, got food sent to these local residents living in that area who were starving. So there was rice, non-perishable food was sent, rice grains, lentils, oil, potatoes, masks, and onions was sent. So this really helped them for a month. So what I'm trying to say, the power of partnerships can be anything. For example, with the resources we have, one of the other things for me, that when I used to travel, now we are not traveling because of COVID, I used to ask everybody, when you're going to the hotel, please pick up the soaps. They used to go like, why? I said, because these soaps come in useful for people in homeless shelters, to drop off in religious places where, there is so much of work done, because so many people do not have access to soap. So they used to collect soap and shampoo and drop it off. So now, because of COVID, we are not able to drop it off, but we call it Soap for Hope. Collected so much of soap. My students have done it. We have boxes everywhere. So, and then I always send messages to friends and family, post-COVID, again, when you travel, make sure you pick up soap. So these are the little things for me. And I really like what you have on your WhatsApp cover. It's such a positive message, like recycle. So this is what we did. My daughter's old high school was collecting clothes. So we look like, you give your bed sheets you don't use, your towels you don't use, because you know what? We are fortunate we have something. So whatever we don't use, and this is what I tell my students, you don't have to be a millionaire or a billionaire. Whatever you can spare. And that also, during the holy month of Ramadan, you do so much of charity in, I think, zakat, isn't that what it's called? It's so nice when you give a percentage. So I think this is important. We all need to see that, okay, if I have 3 of these, I can give away 1 to somebody. Because I'm not going to drink water 24 hours if I have 24 bottles, each from one. One and a spare one is enough for me to use. So this is what I'm saying. It's the power of partnership. So even maybe reaching out, and I hope your viewers, after listening to this, will think that, okay, we have this which we are not using. So maybe we contact Femida in her TV station, or she may put us in touch with somebody. Where can we collect? These are the simple things, and you feel so happy you did it, and it's a win-win situation. That's why I call it purposeful partnerships of doing what we can. For example, now, COVID in India is horrible. They don't have oxygen. So what we are doing is a lot of us are coming together to see what can we do to help them. So it's just not at the government level. As private citizens, we all can do so much with what we have, because there's always somebody who has more than you, but there's somebody who has less than you. So with whatever we can spare, again, we don't have to starve ourselves. You don't want to starve your children, your family. But if there's something extra, for example, clothes, like you said, it's such a nice thing to recycle it, or books. When my daughter was younger, all the color pencils, everything you don't use, like every school year they go buy new things. So recycle them, give them away. So I think this is what I'm talking about, the power of partnerships. And that power of partnership can come with you, with somebody else in your family, and even from within ourselves, because we need to partner with ourselves to make ourselves strong and to see what can I do. Because at the end of the day, we need to ask ourselves, did I do something which helped somebody and made me feel good without inconveniencing myself? So whenever I talk to people, I say, yes, you are an advocate. When people say, you're an activist, I said, yes, but I'm not somebody who goes screaming. It needs to be done in phases, very nicely and practical. It's not going to help saying, oh, they don't have masks, and go screaming, yelling at this one, that one, people in power, writing petitions. Yes, but what can you do? We need to sit down. Okay, these are the resources available. This is what I can do. So you see, that is why it is the power of partnerships. Like you're partnering with me. Very good example here, to talk about what matters and to see how can we do something. And you just so nicely said you're going to put your information, because at the end of the show, if somebody wants, and you said, if I could help you, and I gave you a thumbs up sign. So whatever we can, we need to do it. Because remember, ladies, gentlemen, and Femida, and your great crew, this is like a ripple effect. If you throw a stone into a pond, it becomes bigger. So if we partner to help, these little things become so big. I hope I've answered your question about partnerships.
Yes, definitely. You've also made me realize that the power of charity comes from purposeful partnerships. So we're gonna take a quick ad break now, and we'll be back with Dr. Murthy in a while. Welcome back. We're speaking to Dr. Murthy from the United States of America, who's giving us amazing tips today and ideas for women who can go out and take on new challenges and assist each other, give each other a call once in a while, see how you're doing, just keep in touch with each other. Dr. Murthy, we were talking earlier on about the power of charity. It's the month of Ramadan, giving, and how purposeful partnerships are so important during this time. And, there's another concern that I just want to quickly, just ask your advice on this. I've been watching the news, and I've noticed that, women in France have been outspoken on social media about the new draft law that is being passed as new legislation. Critics are saying that this targets the Muslim community. What are your concerns with the impact that this could have on the mental state, the mental health, well-being of the young girls and the women in France?
Thank you so much, Femida, for making me aware. I was not even aware, because you know what, I guess we're all so much into COVID, but thank you for, educating me about this. Well, as a private citizen, and also I do not discuss politics, but one thing you're asking me as a woman, and I think the way we dress is our cultural identity. And I think this is our wish. This is an individual freedom. And what I wanted to say is, with regard to mental health, again, I think it's like people coming together and not violently protest, but to make a statement that, this is not something I agree with, and this is a personal freedom. And every person has the right to, live without some discrimination. And if they're doing something which is not harming somebody else, I think they have a right to express themselves in how they dress. So that is what I would like to say, Femida. And you know what? And I would just say one thing is we should never shy away from making a comment or making a polite a statement saying, I'm sorry, but I respectfully do not agree with you. And this is a personal freedom. And, I think I would like to do what I need to. So again, this is not a political statement. You just asked me for my view, which I did. And I wish everybody, best of luck. And this is what we need to do, because we need to make our opinion matter in a respectful way. That's why you journalists come in, because the power of the pen or the speech is so much more than angry words or, weapons. So thank you for educating me that I did not know about this. This is something which can be very stressful for people living in countries where they want to enforce this. So that's all I would say, is that we all need to come together as women to say that this is a personal freedom. I hope I've answered your question to the best of, I know you journalists, you always ask us like a tough question and you go like, okay, this is what I think. And, so that it's no disrespect to anyone, not criticizing anyone. But I think this is a personal freedom which each of us has.
And Dr.
Or
Murthy,
should have.
Yes. Dr. Murthy, there are women leaders that are doing work out there, and I just wanted to know from you, do you think that there's more work that needs to be done, including, with women's health issues and empowering women out there?
Yeah, thank you for the question. Yes, we do have, because, as you know, the Beijing Platform of Action, it's 25 years, which talks about the 12 critical areas of concern for women. But very briefly, I think there needs to be more work done out there. You don't have to be an elected official. We are all leaders in our own way. And I think collectively coming together. And the other thing is, women need to have more of a seat at the table. For example, New Zealand, do you know they just passed this law that any woman after abortion has leave because she has to cope with the stress of losing a child. So what I'm saying is that's because New Zealand has a woman prime minister. So what I'm saying is women definitely in key positions can influence policy. So I think more women need to have a seat at the table. And, and I think it's important. If you're not given a seat at the table, pull your chair and sit at the table. That's what we need to do. Because today, I think you created the opportunity for me by asking me these questions so that we all are, like we talked about issues. I mean, we talked about feminine hygiene products. We did it in a way which was very respectful. And, you're not being judgmental. That is the crux. If we want to get our message across, it cannot be judgmental. If we need to do advocacy work, if we need to have a purpose which makes sense, purposeful partnerships, there needs to be respect. And you need to respect yourself first. You need to respect the others. Then you come to middle ground. They cannot be enforcement. So I think this is something, yes, more work needs to be done. And I think it's across all sectors, whether you are an elected politician or not, just a woman, a girl, we need to speak out for ourselves. Tomorrow, if you're doing something, you reach out to me and say, okay, maybe this is what can be done in South Africa. I connect you with somebody. And the other thing people need to remember, that by these connections, you become more powerful. It's like your 5 hands, you can make it a fist as opposed to just one thumb. So by connecting with people, You're not losing your greatness. You're not losing your power. Actually, you're bridging and building some more things. So I hope you've answered your question. And last but not least, we need the men to work with us. We need men to work with us. And woman, WOMAN, in the spelling of a woman, a man is included. So just to tell you how, because we need to work together. We cannot do this without men. And men also need to understand, by supporting women, they are not losing their machoism, but they're actually building, again, purposeful partnerships for a better family, better community, better country. And more than ever, Femida, with COVID, this is the message I want to get across. Like somebody was talking to me yesterday, they said, like, if you want to do a talk on TED, what would it be on? I said, it's about the power of purposeful partnerships, with respect. I hope I've answered your question.
Thank you so much, Dr. Murthy. That was an excellent information about how people can work together, purposeful partnerships, contributing charity, helping each other without spending any money, a phone call, a WhatsApp to women out there that are going through considerable situations, circumstances, being the breadwinners of households. Dr. Murthy, we'd like to interview you again on our show. Hopefully we will talk again.
Anytime. Thank you so much, and look forward to working with you and your team. And thank you so much. And also let me know, once you get like this thing going, happy to see what we can do together. Thank you so much. Have a good rest of the day. And Ramadan Kareem, and happy Eid. I will wish you for Eid. Thank you so much.
Thank you so much, Dr. Murthy.
Bye.
That was Dr. Murthy from the United States of America, a physician and an activist who's been giving us inside information on how they basically dealing with concerns on their side where women are being burnt out, where there's charity happening on the ground. So inshallah, I hope that we could get some sort of way on how we're going to deal with situations here in the country. So hopefully if you can just WhatsApp me, concerns that you may have, my number will appear on the screen for you.